Afternoon to everyone. I got this message from the governor yesterday that San Miguel, we are asked to share our experience for the past weeks in the implementation of GCQ with heightened alert. As was mentioned already, the original plan of implementing an MSCQ was not implemented because we find it after discussing with the IMT that GCQ is already quite good enough for our problem. Now, our experiences will speak of the not only about the good, probably the worst experience that we have concerning also our people here. We have been bashed, we have been castigated, and we have been gamay na lang o may panungluhon sa among mga kaigsuonan because we really implemented what we planned. Now, in the presentation, Go, please allow me to utilize our DOH representative as well as one of my staff to come out with some reportings on what really took place insofar as the implementation of GCQ with heightened alert here in municipality. I'm giving Mary Grace Buncales to come out with some presentations.
I am Mercy Grace Buncales, the OIS representative in the municipality of San Miguel. I will be presenting the trend of cases in San Miguel during its surge on July up to present. We started with one case on morbidity week number 26. It was on June 28 to July 4, and we peaked at 60 to 66 cases on morbidity week 33 to 35, as shown in the graph at the upper left side of the presentation. It is evident in the number of active cases where we hit at 100 on September 1 of 2021. And our heat map also demonstrates the spread of our cases in the entire municipality. And it is duly supported by our positivity rates, which climbs up to 50%, or one positive case in every 2 individuals tested. This suggests that there is a high transmission in the community. Moreover, 94% of the barangays of the municipality of San Miguel, that is 17 out of 18 barangays, have active cases. This data was being brought to the table to our municipal mayor and the municipal interagency task force, and actions were being taken, which brings us to our present. So this is our present. So though it is too early to say now we are successful with our response, but today we could see a difference. Our COVID case dropped to 17 on week 37. It was on September 11 to 17. And our heat map is not burning anymore. So wala na kayo tinakitaan mga reds. Our positivity rate downs to 21 to 25%. And only 7 out of 18 barangays have active cases. Yet, we are still at day 5 in our full implementation of EO 45. So what have we done in San Miguel? So actually our response was patterned on the Swiss cheese respiratory virus pandemic defense. So we emphasize personal responsibility. So the individual responsibility in each San Miguel non, and shared responsibility. It is our responsibility in the governance. In the health cluster, we ensure fast contact tracing and timely testing as one of our intervention. So this is our classification of cases compared to July to August and September 1 to 18 of 2021. So on July and August, we could see that 3% of, as we term it as local, but these are outgoing individuals who submit themselves for testing for travel purposes, and 2% are upwards in the municipalities. 25% of our cases are surveillance cases. So these are symptomatic individuals reported and tested in our health facilities, which is San Miguel Hospital, our RHU, and hospitals. And what occupies a big chunk in our cases are the close contacts at 70%, and most of them are symptomatics. So this data indicates that with the few symptomatic individuals, the 25%, they had infected lots of San Miguel noon, as evidenced by the result of our contact tracing. These ILI cases attended birthdays, fiesta celebrations, mass gatherings, and even drinking sessions. So we even have experienced nga na may cluster wherein a group of people had drinking sessions. Yeah, all of them got infected, and these people infect each of their families. So isa jud to sa nakapasurge sa mga cases. However, on September 1 to 18 na data sa PCAS na to nga PAI, we could see slight change in the percentage. So slight man lang siya, but we could feel its impact. 36% of our cases are surveillance and 3% are local. And only 6, though as gihapon, but still 61% are close contacts. So most of our surveillance cases recently infected only by the members of its household. So due sa restrictions, they don't attend gatherings compared sa last month. So kasagaran na close contact na lang is kauban sa balay. So another intervention or strategy is our quarantine and isolation. So what do we do with our cases? So San Miguel TTMF is the first municipality wherein we have DOH certified facility in the province. We are certified last July of 2020. So during the search of our cases, our 22-bed capacity na TTMF could not accommodate all of the confirmed cases, but we never let our guards down. We expand our facility. So we were able to cater up to 46 katao ani nga time sa peak sa mga cases. So nag-open may other buildings na may tulo ka buildings nga open para ma-accommodate lang na mga patients. We also open up new TTMF, which is Masano TTMF, which accommodates 11 pero nakaya na mo accommodate og 14 kay naami sa ka-family room. And with the coordination sa DepEd, San Miguel District nga koan, DepEd, they help us nga maka-open up ni og kanang BIUs in all barangays utilizing the schools. So tanan nga mga barangay sa municipality na anami mga BIUs. So kani po sila, ni cater na ni sila ato nga time sa surge, ni cater na ni sila sa mga confirmed cases, mga asymptomatic lang ang mga pasyente. So amo mga walay symptoms, mga kuan lang, mga even close contacts, i-accommodate nato sa ato ang barangay isolation units. So how kanang giunsa man namo og operationalize ang amo ang kanang TTMF. So it's been a question to some. So our municipal TTMFs have DOH NDP nurses on duty 24/7. DOH also augmented our manpower with 2 TTMF nurses in the response to surge of cases. Tanan namong patients admitted were monitored by our MHO and nurses, and they all have undergone laboratory tests, including X-ray to some. So na mag-need og X-ray, X-ray dyan na namo. Naami close coordination between hospital and our TTMF. They were also provided with free meals. So kanang mga gipang-isolate, libre na siya og pagkaon. These expenses were shouldered by the LGU and among PhilHealth claims, since ang PhilHealth claims namo kay it cannot sustain financial needs man and operationalization sa TTMF, naadjud gyapon fund sa LGU nga nitabang. On the BIUs, or atong barangay isolation unit, last year we have trained medical or health volunteers, BHWs, and other volunteers, including youth nga willing mo duty sa atong isolation. So they were taught on donning and doffing of PPEs, disinfection, kung saan magkuhag vital signs, how to monitor patients. So They man the BIUs 24/7, and they also receive honorarium from 200 to 250 from the barangay and 150 from the LGU per day. So stay in na sila sa facility kung mag-duty. Lastly, among last na intervention when it comes to health cluster, we have our vaccination. We are still advocating for COVID vaccination, especially to our senior citizens. And most of San Miguelnans are interested not to have their shot of hope. However, we are dependent on the availability of vaccines. But as to consumptions, we were able to consume whatever vaccines being allocated. So mo to ang amuang strategy when it comes to health cluster. As to other strategies na mo, it will be presented by Ma'am Saysay.
Good afternoon, everyone. So this is Jean reporting on behalf from the Office of the Mayor. So as you can see here, I'll be talking about essentially what we did during the height of the surge of COVID-19 in San Miguel. When we reached the surge around last week of August, what we did is really focus on strengthening our vaccination efforts. We wrote to our BIATF and to our PHO for additional vaccination support. And together with our efforts during the surge was the focus in activating our schools as BIU. We immediately wrote and asked the support from our DepEd, and thankfully they were eager to respond positively to our request. As mentioned by Ma'am Minmin, we were also able to urgently add the Masanaw TTMF as an additional facility. We also, during the surge of the infection we also tapped our religious leaders for awareness. They really helped because it was evident almost every after mass, our priests helped us in raising awareness to increase our vaccination efforts as well as to restrict the movements. When it was evident that there was the cases were going up in an upward trajectory, so we had an emergency medical and IMT meeting wherein the Ms. Maminmin and together with the medical team presented the data and statistics, which led to a recommendation for MECQ from our IMT team. Coincidentally, during that time, it was released around 2 a.m., the confirmation of a Delta variant in San Miguel. So it kind of came, it was a good support to our petition for an MECQ, which we also raised, which the mayor also raised to the BIATF. After that recommendation, first week of September, we went into an intensive info drive. We spread awareness with regards to the local Delta case and plans for stricter community quarantine. Basically, we instilled fear in a way that we really asked them that we put discrimination on those unvaccinated. We also informed the community that we will be implementing soon a stricter quarantine wherein their movements will be regulated. So first week pa lang, nagpalabas na kami ng mga ganun na initiatives. As you can see here, hold on. Yeah. These were all over San Miguel during the first week of September. We also give out flyers to our senior citizens and to the people in the rural areas regarding this. As you can see here, it's a little bit small, but natin mga pahibalo ug hangyo, especially to our senior citizens to really submit themselves for vaccination. And we also put a discrimination in terms of unvaccinated vendors in our public markets because it's one of those high traffic places that we really need to regulate. Around September 8th it was when the EO 45 was officially implemented. By the way, during first week of September, when we already decided to go for MECQ, the office also prepared the requirements for our IATF, including everything from the supporting documents required for MECQ. But a day before that, there was a BIATF gathering wherein the GCQ HQ was discussed. And after careful consideration and comparison, it was unanimously agreed that we shall, instead of pursuing for MECQ, we will strictly implement the EO 45, which with your approval was clarified that it's for GCQ with heightened restrictions. So ayun na, around September 10, we reconvened the IMT together with barangay officials, the DepEd, religious groups, as well as the Army and PNP and SAF. So ito na yung na-discuss kung we clarified what are the restrictions that we will be imposing. And we didn't do anything special. We just went and followed strictly what was indicated on EO 45. After this event, it was all hands on deck. Everyone was, we had the support from DSWD, and we also had preparations of the IDs and food packs, as well as the necessary paperwork. We also proceeded with the issuance of IDs and passes. It's important to note that on September 11, before we really publicly implemented our GCQ with heightened restrictions gov, what we did was we deployed kind of an advanced deployment of our uniformed personnel. We really informed or forewarned our public about the strict implementation of our GCQ with heightened restrictions. So nagrekorida, ng hatag-tag flyers, and we really informed them that we will be imposing stricter regulation, especially with regards to their movements. So here are some of the, as shown earlier, we activated the home quarantine passes, and we also have this I am fully vaccinated, which can encourage those people to go around if they are fully vaccinated. Those that were supposed to be stuck at home can go out if they are fully vaccinated. Yeah, so we also submitted some simplified flyers for those in rural areas. So we didn't just rely on our social media to inform the public, but we really gave out, thankfully with the support of our barangay officials and IMT, as well as our Sangguniang Bayan, we really gave out flyers, everybody, all hands on deck. It was really a team effort in making sure that the awareness regarding the upcoming GCQ with heightened restriction is really imposed. So yeah, as you can see here, we are, as Ma'am Minmin mentioned, we are on our 5th day of our strict implementation of the GCQ with heightened restrictions. So ito yung makikita nyo sa borders. We have patrols, we have uniformed personnel sa entrance and exits. We also have an ongoing public address system announcing and explaining the importance of getting vaccinations and reinforcing the regulations for the GCQ with heightened restrictions. Mayor? Yes, sir.
Insofar as how we started and the activities that we undertook for the past 5 days and even prior to the actual implementation, I think it's vividly and illustrated by two of my staff. But we cannot say that we are successful at this moment because we're still on the 5th day. Wala pa may mahibalo kung saan mahitabo in the coming days. But the records, the number of cases na we successfully reduce is already a manifestation nga doon na po'y kausaban sa among mga na-experience. Now, actually, there are a lot of challenges that we have encountered. Number one is ang among mga katauhan sa merkado, grabe, kontra na kami. We're always bashed in the social media. We're insulted. But we just continue doing what we believe is right. Because if we will not do these things, who else will do that for San Miguel? So, napugos mi nga, amo gining ipadayon. And that's why I was hesitant at first to follow the instruction the Gov you share, because this is still very premature. But thinking also nga, maybe we can get some inputs that can help others, especially nga kung nahimo na mo ni sa among lungsod, there's no reason nga others cannot also do it, because I know you are much even ready for things to happen. But kini, with the joint efforts of the LGUs, the barangay councils, the barangay captains, the religious sector, the DepEd, medyo makita na to nga doon na yung diferensya when you work as one. Because all the while, we are very much worried. Imagine from September 1, we had 100 cases. And presently today, as of 2 o'clock, we have now only 14 active cases. So nindot ang medyo ang among dagan, but as I said, we are not claiming that we are successful, but still we are working hard on this. Now, we will not also be, bisan pag ma-level up na mo ni, but we will not be happy about this. And dili mi mahiluna niini tungod kay we want also others to have the same output kay mo man giingon we are not safe if all others are not safe. So maningkamot ta, and thank you also for the opportunity that we can share this to everyone. Now, it was mentioned by one of our kay Minmin that about this Swiss cheese approach. Now, we grab this practice because there is a saying that says that no single intervention is perfect at preventing the spread of the coronavirus. Each intervention has holes. Now, if you will see, this Swiss cheese is not edible, but it will really save lives. So if you have any questions, we're ready to find a way that we can also share to you the best answer that we have. So thank you, Gob, and thank you all mayors and everybody.
Yes, please.
Anggong, thank you, Gob.
Yes,
Mayor,
please.
may hapon, Mayor. How many
May
police
hapon.
officers?
Board.
How many police officers do you have, Mayor, in your town?
Yeah, I forgot to mention, we have only 14 and some are still on field duty, but we were able to get assistance from the Philippine Army and also from the SAP. So actually, we have about 50 uniformed personnel working here, and we have contained and established checkpoints in the exit and entry points in throughout San Miguel. So we are very happy with the assistance provided by Colonel Salibo and with the Philippine Army, kasi they were also all out in helping us because we appealed to them. Sabi niya, tulungan mo ka sir, kasi medyo masama na itong dating sa San Miguel. So nandito naman sila, but we're happy about it. And aside from that, board, we have been also preparing our food packs for our poorest of the poor in the community. So ito rin ang pinaghanda namin. Siguro anytime by next week, this week, we'll be distributing this. And not only the uniform personnel, we have fully utilized our barangay tanods, including barangay officials. They are there manning because we agreed. I told them na og madili na magtinabangay na nothing is going to happen. But they showed their help. So naapod mga opisyalis sa barangay. So and likewise, we also came out with some notices nga ang among mga kining mga daghan man jud tang mga motor din ng mga wire rehistro. and also mga batanon. So we have been telling our people, if you will bring your motors without registration o wala mga driver's licenses, definitely it will be impounded by the police. So dako sa yun impact sa among mga kabatanunan. Okay na, board?
Thank you, Mayor.
What is clear, Mayor, is that it's very possible that if you do a circuit breaker for 3 weeks, you can bring down your case dramatically. But
Well,
you have to really be serious about it.
that's possible. That's very much possible, Gob. If magtinabagay lang yun ang lungsod, or everybody of us here will just cooperate with each other, madungan ta, then probably that we will have a good positive result. Kay ug mahimo gani namo nga we are a small community, a small town, mahimo namo with all the limited resources, but we have no other choice because we cannot allow that these things will just grow and magtanaw lang ta.
Thank you very much. Secretariat, please post in the Bohol Mayor's Viber thread at least the experience, the slide on the measures adopted by the municipality of San Miguel, and also the data on the drop in their number of cases, please. Thank you very much, Mayor Mendez.
Thank you, Gob, and to fellow mayors. I know this is not easy for us to decide, but and we will not be even claiming that we are successful. We are still in our drive and fight. So I know dapat ay panahon, let's work together because no one is safe if not all of us are safe. No matter what happens to us, na-reduce na mo ni, but we're not also comfortable nga other areas, taas pa ang COVID. So I know that we can find a way and we will have a solution to all these problems. Let's help each other.
Thank you, Mayor Mendez. Just a clarification. When you say that there was discrimination of unvaccinated, you targeted this to your vendors in the marketplace?
No, not only the vendors, but more on the senior go, because you know that is the common problem among us, nga very hesitant o niya masuko pa og pabakunahan. So what we did is we came out with some flyers telling na if you're not vaccinated, please avoid going to the market or stay outside because we do not want you to be infected. Just like here in the LGU, kung doon na may mga sakop diri nga wala pa magbakuna, we also advise them, do not report to your office, otherwise you'll be infected. We will find a place for you outside where you can hold office para dili ka matakdan or dili ka magdalag kagaw sa imong mga kauban. So this is one way of telling these people. We have been telling also nga, if you will be taking the buses, you will be discriminated if you do not have any vaccination. So ang nahitabo ko, nag-away na ang mga tigulang na mo diri, ang other people who wants to be vaccinated. And our problem now is more supply of vaccines.
Here, when you say preparation of IDs, you're talking about the regular IDs, yung mga usual, yung mga sa una, yung mga atong giandam na mga IDs, like mga family cards, IDs.
We came out with new IDs, Gob, kay bago naman among Cebu Police, but the same concept that for every family, there is only one quarantine pass that will be issued. So in the event that they will be going out of their residence to buy some essentials, then usalay makagamit. Then insofar as kining mga working, we are also issuing working pass for those taga San Miguel nga who will be going out to Talibon, to Ubay, to Tagbilaran para pagbalik nila, they will not be having a hard time getting inside. So yung na lang so that mamonitor yun na mo. Then we also came out with a list of the San Miguel noons through the barangay captains nga ilista nila, isubmit nila itong mga list of people under them who are working outside because we believe that kining mga nanarbaho sa gawas muli are usually the carriers also of this virus. So ingon ana ang among mga approaches. Now kining among am I vaccinated go? This is just an awareness activity para makitaan sa mga tao, they will be proud kung vaccinated na sila. Because when they go to the market and vaccinated sila, then there will be no more, wala na yung mga, once upay check up because they are also having this I am vaccinated card. Just like parang just to encourage people to get vaccinated.
One final question, Mayor. Before, about 2 weeks ago, you were at 60 plus cases, and am I correct? More than 60 plus?
September 1 go 100.
September 1, 100. And today,
We have only 14.
in close to 3 weeks' time. In 3 weeks' time, you brought down your cases to just 14%. What we're going to
pito na lang ang dunay kuan infection.
down to 7.
And I have some corrections insofar as those isolation facilities because actually we have 7 active patients inside our isolation facility. Wala lang siguro to ma-upgrade ang data. But ang amo lang, we have 2 family members nga totally kuan kaning infected nga gi-allow sila og vaccination kanay mga bata. Home.
What we're going to do is post at least the San Miguel experience to share with our mayors. So this is a very clear statistical evidence that it is possible to impose a circuit breaker for 3 weeks. And within 3 weeks, then at least there's a big chance to bring down numbers. Doctora MM, you want to say something?
Yes, Gov. Thank you, Gov. The experience of San Miguel is very impressive, no? And I just like to highlight that aside from their success this early, with regards to bringing down their numbers, I'd like to commend them on the use of the TTMFs also. I noticed that they had high number of patients admitted in the TTMF over and above their bed capacity, but they were able to manage. So, murag example, gid ni siya that the TTMF can really help. Otherwise, these patients would have gone to Galeares Hospital and the other hospitals in Tagbilaran and contributed to the already overflowing scenario there. And one important thing that I'd like to highlight also is their utilization of the manpower, because like we said before, lisod na kayo if we insist on the professional health human resource, no, which are the nurses. Nindot kayo nga ilahang gi kanang gamit ang ilahang mga at the barangay level and really train them and give them commensurate honorarium for their efforts. So naagid sila kanang kuan pod murag motivation to really do 24-hour duties in the isolation centers and the TTMFs. Kay na sila honorarium nga peto 250 from the barangay and 150 from the municipal LGU per day. So instead of giving this as salaries to our nurses, we can give them as honoraria to our barangay personnel nga who can do the job, no, like our BHWs, the BNS, or other, even the barangay officials who can do the duties in the TPMF. So nindot kaayo. Congratulations, Mayor, and thank you for sa pag-una ani so that we can also follow. Thank you, Gov.